happy to have you here, Doctor, in our episode of the QCast.
Thank you. Thank you for having me.
Yeah. So actually, we're gonna clear some misconceptions for our patients today. So actually, do really people coming to your clinic asking for a different person to be a totally different person than their personality or appearance?
That's not the usual case. People usually come with issues or real problems and that they find aesthetically unpleasing. That's the majority, most of the patients. Of course, you get also the odd patient that comes and asks for something that's not achievable. You cannot achieve it.
They can ask for to be like J-Lo, Jennifer Aniston. I want to have that body, that look, that face.
But like I said, this is not the usual. And then of course we kind of, as you get more veteran in surgeries and more practice and more experience, you kind of suss out these patients and know when not to engage with them or even offer them any surgeries or anything.
Yeah. So what is the most popular myth in the plastic surgery?
Most popular
myth, like the patient is coming to do the surgery and I will never go to the gym ever again, or
no, it's not as much so much as being a misinformed patients, or that maybe expect to have results immediately after surgery, and that's probably the most common issue with patients. They expect results really fast, especially with nose jobs, rhinoplasties. Patients, they see in movies patient does the surgery, first visit to the doctor, they take off the cast and everything is gorgeous and beautiful. No, there's a lot of swelling, and that swelling will take a long time.
This will move us to the next question about the high expectation of the patient, really.
That's another subset of patients that you have to kind of always look out for, which is patients with high expectations or unrealistic expectations, because these are the patients that usually come back and haunt you, because they will never be happy.
Yes, I totally understand that, doctor. So actually, did you refuse any case for a patient?
Of course, yeah. As the more that you get veteran, the more experience, the more you do this and more years pass by, the more you kind of get to be an expert on when not to operate on patients. Say, okay, fine, this is a red flag right here, maybe 2 red flags sometimes.
Yeah.
That this patient you never touch, and you just send them back home.
Yeah, the patient accept while you are telling her that we cannot do this for you. It's not suitable for you.
Yeah.
And the patient can accept that answer from you. She's coming with a high expectation to do the surgery.
Yeah. There's many ways that you can actually say no, but being polite at the same time, telling them that, this is out of my reach. I don't have that expertise to give you. So maybe, move along to the next clinic or next hospital, whatever. Yeah? So it's on the long run, that's much more peaceful for me, because, at the end of the day, if you get a patient that's not happy, they keep on coming back, and they can, and at the end of the day, it's just nobody's happy. And so.
Yeah, actually,
you haven't done that patient a favor by operating.
Yes, perfect. This is very honest and very. So, doctor, the patient coming for the social media, it's booming now, and the patient is all the people actually, not only the patient, using the social media platform and using that filter. So they can come to you showing you this filter. I want to have this exact nose
if you
or face.
Tell you about the number of times that patients do come with pictures on their phones that are totally fake and totally touched up and filtered and they believe that that's the way it is, and that they went to that doctor and they got that result. So sometimes not all people are very transparent and honest. You gotta be careful.
They used to have that smooth skin, perfect nose, wide eyes, lifted face. They want to have that. Everyone actually wants to have that.
But even with the advent of AI now, it's very difficult to try and say what's real from what's not real, And then, you get a patient that sees that picture somewhere on a site or an account, and then, they just kind of, expect that now, So, like I said, I always say this, if you're a 3 out of 10, I can make you a 6, a 7 on a good day, I can make you a 7 out of 10. But don't be a 3 out of 10 with no disrespect to anybody, but don't be a 3 out of 10 and expect 9 out of 10. It's not going to happen, So everybody has limitations, with their, with what God gave them. You know, the genetics, the body build, everything, you know, the backgrounds, you know, so not everybody can get the 9 out of 10 or 9.5 out of 10. So if you're a 3 and you're a 6, be very happy, you know.
Yes. So at the end, doctor, what you should provide from an advice, piece of advice for our patient after the surgery, so she can maintain the results, can maintain
the results. Yeah, I mean, you know, this is, I mean, healthy lifestyle, not to fluctuate in weight, all the don'ts, you know, don't smoke, don't, you know, stay up late, not too much coffee. If you're out in the sun, you know, use SPF, sunblock, 50 and above, hydrate all the time, and exercise.
So the myth about that I will never hit the gym again ever in my life.
You have to hit the gym. You know, always.
Yes, it's perfect. It will maintain the muscles, the body.
Yeah, sure. As you age, you lose muscle. So as you age, you need to go to the gym even more and more. You know, so healthy diet, not an extreme diet, but a healthy diet. You know, well balanced diet, and then that should serve you for years to come.
Yes, actually, we should tell our patient that we don't have a time machine here, that
There's
we will
no
not
time
get
machines
you.
here. No. Yeah. You gotta do your homework.
Yeah, exactly. So, doctor, what is the most trendy procedure of the plastic surgery?
I mean, look, from the dawn of time, liposuction has always been our bread and butter, always. Most trending procedures right now are, you know, the usual BBLs. It's very trending. 10, 15 years ago, people used to do liposuction and get rid of their fat. Now nobody gets rid of their fat. Like 90% of people want their fat to be re-injected in breast, buttock, face, whatever, hands even, to give them that youthful appearance. Other safe trends, you know, is the deep plane face and neck lift, which is kind of the Rolls Royce of facelifts now. It's a very safe procedure if done properly. Gives the nicest, long-lasting, natural results. Again, if done properly. There are trends. I mean, I'm talking about cosmetic surgery now.
Yeah.
We're not talking about the machines and lasers and all that kind of stuff, because there's always something new. Probably, you know, they talk about like, you know, what's new and all that kind of stuff. There's this rib surgery they talk about now, is patients that want their waists to even be narrower and narrower. The waist aesthetics is largely determined by genetics. So, okay, not everybody has a nice waist or small waist. Even if you go and do the sculpting and you take out all the fat, they might still have, the waist is not as tiny as they want it to be, because they saw on social media, of course. So now there's this surgery where you actually kind of break a rib to take it out, so the waist gets narrower. And of course, it's very controversial.
Yeah, you think there is a side effect for this procedure?
I mean, why did God give you ribs? So you can protect your lungs. To protect your lungs, you know. So now your lungs are all exposed and everything. No, not a good idea. Even though they'll try, some institutions will try and push it and sell it to you and all that. But, you know, no. So at the end of the day, it should be safe surgery. You know? It's cosmetic surgery, so it's unnecessary surgery. So other than that, you know, I mean, you know, trends actually in plastic surgery and aesthetic plastic surgery are set by fashionistas most of the time, you know, and the whole, you know, culture of this BBL and all that was founded by whom? By, you know, whatever, the Kardashians and Nicki Minaj and J-Lo and all these people that emphasize that part of their body, and then all of a sudden the whole world wants to look like them.
Yes.
So, but with regards to techniques and procedures, we're moving very slow actually.
Are you receiving mostly patients coming from a failed procedure from another doctor, or?
Of course, yeah, you botched surgeries. Yeah, there's always botched surgeries. There's always patients that are unlucky, or that want the cheap way out, want the cheapest surgeon to do the surgery for them, or maybe something in their genetics again that ended up giving them a bad result.
Yeah, so I think that their choice about this procedure in the doctor, or the procedure that they didn't choose properly, the right procedure
again,
for themselves.
it's a whole bag of issues here. But mostly, let's talk about the most common scenario here is when a doctor botches a surgery. Okay, or he does not does something wrong, and the patient ends up with an issue, cosmetic issue. We see a lot of those, of course, and now we're seeing more and more of those actually from people coming from abroad. This is one thing with medical tourism. Patients go to countries like whatever, Turkey, and then because the surgery is so cheaper there, so much cheaper, but not everybody in Turkey is a good surgeon, so a lot of them end up botched, and they come back here, come back home, and then they don't have the surgeon next to them, and they're forced to go somewhere else to try and fix the problems.
So they should actually advise or listen to the advice of the surgeon, of their doctor. Choose a very trustable doctor to do their procedure, so they can take the most reasonable or actually successful result for their body.
For sure, yeah. And also do your surgery locally. Don't go to another part of the world and have your surgery done and then come back, and then because if you have issues, unless that level of expertise is not available locally, then you go. But if it's available locally and you go somewhere else just because it's cheaper, then that's also.
So, doctor, you mentioned earlier about the filler fatigue. Actually, can you tell us?
I mean, filler fatigue syndrome is something that's recently seeing. I mean, let's picture this scenario. So patient goes to the dermatologist. She feels like she's a bit getting older. Her cheeks are not as puffy as before. And she goes and she gets fillers done, and then all of a sudden, everybody's complimenting her. She's so happy. Everybody's saying, "Oh, what did you do? You look 5 years younger." Blah blah blah. So I mean, the patient all of a sudden wants to hold on to that feeling, and then the minute that she feels that filler went down a little bit, she'll be running back to that dermatologist. Inject me some more. Inject me some more. Of course, not every dermatologist and every doctor have ethical standards, but some of them would just keep injecting. And then 2, 3, 4, 5 years go down the line, and she opens an album, and she sees her face before, and then she looks in the mirror and she gets a shock, because that kind of creeped up on her slowly, and she's getting weirder, slowly, and having that freaky look, and nobody's going to tell her.
And she seems older than her age.
Yeah, and she's just not her, different person. And of course, so she runs back to the dermatologist, to dissolve everything and all that. And then, of course, that's when she has to kind of consider real solutions to her issue, which is like we're talking about then, facelifts and stuff like that. That's the job. But what I'm saying is, in that fillers in moderation is always good. You got to wait till the filler kind of runs out its course and re-inject, rather than just keep on topping. And like, I'm not against anything, but if you look at all the Arab singers and from the Middle East, they all have kind of the same look.
Yeah,
they all look the same. And I think their faces are like, somewhat don't look natural. So you got to know when to stop with the fillers, so.
Yes,
and then think about more about solutions that actually get the job done and make them look normal and natural.
So they can get that look instead of the filler, or not instead of the filler, but they have another solution, which is facelifting, which can lift the face. But what about if they need to make it fuller or bigger?
Yeah, I mean, if they need it, if they are deflated, then you put some. Yeah, I'm not against that. I'm against the ballooned out face that and the huge cheeks and the huge everything, and I mean, just look at the social media now and see. Look at the faces.
Actually, this is the reason that makes everyone is crazy.
Being natural, looking natural is game. Is what you.
I hope that they will search for those people. One time they will search and collect those natural people, and they will put in a safe place or something. Do patients often come to your office or clinic to ask you about unrealistic expectation about their body or face?
Yeah, again, unrealistic expectations. It's a whole subset of patients, But the most important one that you really have to look out for is what's called body dysmorphic disorder, BDD. These are patients with a mental illness. They have a psychological issue going on, and they need to see a psychiatrist. Why?
Seeking for perfections.
No, they're not perfection. They're focused on one part of the body, and they think it's absolutely hideous, and it's and everybody's looking at that part, and most of the time they kind of try and hide it from everybody. If it's a stomach, they try and hide the stomach. If it's a nose, they wear a big hat to try and hide their nose, and they're obsessed, and they really think there's something wrong with their nose. Now, again, this patient ends up in your office, and you try to convince yourself there's something wrong, and you go in and try and fix it, you know, and of course, patients are not happy. Even though their nose is perfect, was perfect, and still is perfect, but they're not happy. I'm only talking out of experience. I had one guy who came to me and then said his tip was, a little bit big and all that. And I tried to convince myself, okay, let me try and help him, It's not that bad, but okay. Of course, he comes back again. Oh my God, your job is beautiful, but this one is a little, this one is a bit off this. And then I did it again, and then a few months later, he comes back again. And this is when I really, because I knew about this body dysmorphic disorder, but I never kind of encountered the patient that had this disease. And then he kept on coming back, and I stopped, even actually the second surgery, I didn't even charge him, because I didn't want down the line to be kind of sued and they say, oh, you did it because you're taking money. No, I'm not taking money from this patient. So, he ended up coming again and again. So I stopped. After the second surgery, I stopped. I said, no, I'm not going to help you. And I know for a fact he went somewhere else. And he started doing the surgery somewhere else.
Oh my God. So you think that we shouldn't touch those patients?
Of course,
we will not help them even. It's kind of mental illness. So
it is, yeah. They need a psychiatrist and not a plastic surgeon. So, as you, like I said, as you get more patients, you're bound to get these patients in your office. So beware.
Yes. Red flags.
Yeah.